Medicaid expansion is inevitable, and we look at it perhaps as being stalled by House Republicans in the legislature, and that's just simply not the case. This isn't a bipartisan issue as much as it is a political issue, and there are members of the legislature and leadership that have a problem with the current president, and it's, I think, more of a personal issue. The Florida Senate has been willing to offer legislation and bills that would expand Medicaid and close the gap for upwards of 600,000 to a million people, Floridians in Florida. So I do believe it will happen. It's going to happen. It's not a matter of when that's going to happen. It's a matter of who's going to have the courage, who's going to be able to consider themselves a hero, which you'd think they'd be jumping in line for, to get this thing passed. My guess is we're going to shoot for 2018. We want to see something. It's very conceivable that could occur. And certainly with a new governor and some leadership out of the governor's office, there might be more use of that office as a bully pulpit to get some things done. One thing to keep in mind, I said it's not partisan. It was Democrats actually in the early 70s that held up Florida basically not engaging in the first Medicaid program. It took 5 years for Florida to actually be part of that. And so it's about 5 years on the expansion issue, but you have to be an optimist, and with time things change, and Florida Chain is here to make sure that occurs. I've always been involved with nonprofits, and I've tried to do some things in life that allow me some quality of life, i.e. feel good about what you're doing, try to make a living. So the legislature was important to me in terms of actively participating in that legislative process. And as much as I was in the minority, a Democrat, in a very, very strong majority, place where Republicans are in control, I do feel like I had an impact, at least in terms of putting things on the record and providing the other side of the story, what I would consider in many cases truth. That said, that career's ending, thank goodness, November 8th at midnight, not that I'm counting. And so Florida Chain offers me a great opportunity to do good in my personal, professional life. But it also allows me to employ all these new skills that I have in terms of understanding that process of the legislature. Chain's mission is to increase access and to make sure that people have quality of care when it comes to their health care. Well, you can't have quality of care until you have healthcare. And so one of our biggest priorities is in fact expanding Medicaid and giving an opportunity for people in poverty, and that's who we're looking at right now. People in poverty, the ability to go see a doctor, the ability to get sick and not end up in an emergency room where the consequences are far more potentially dire and where the expense side is through the roof. You'd think this would be something simple. It is. It's not like there's money out there. There is. As I said, it's a matter of time, and that's one of Chain's big priorities right now. The League of Women Voters, first of all, has been outstanding. And in terms of an organization that takes in all sides of politics into a place that's nonpartisan, a place where very good, well-intentioned, meaningful people get together and work on important things. The League does a great job. In fact, arguably, through its efforts in the last couple of years, Florida's probably the resulted outcomes of litigation, those type of things, have resulted in a Florida that's probably more fairly represented in Tallahassee. In terms of how Chain and the League can work together, It's very important that we continue to partner, that we continue to work together on the goal of expansion in terms of healthcare, but also continuing to improve systems that are already in place. If Medicaid, has fraud, well, let's work on that. If there are questions about how we provide service delivery and who's getting service, let's talk to that. The league offers that in a very nonpartisan way, and that's very, very important. Chain needs to continue to help coordinate statewide efforts with partners like the league, from Key West to Pace, Florida, which if you've never heard of Pace, it's in a different time zone. Chain actually has a board member in Pace, and I had to correct my watch on my my arm in my car. But it is a statewide effort that's going to require a very long-term effort, and partnerships are going to be key. And in fact, I'll go on because I know we're going to edit this. It's critical that the league's role in talking to candidates and asking them where they are on particular issues occurs, and the questions are precise, because getting an indication from a candidate as to where they stand or their gut stance is on an issue can help voters understand who they're voting for and which candidates bring them the highest likelihood that somebody voting in the legislature is going to actually vote their priorities. So the league's got a tremendously important role here. Chain's making a very serious effort into targeting certain areas where future leadership in the legislature will occur. Dade County, Miami-Dade County, I'm from Dade County, but it's Miami-Dade County, is a hotbed of activity. We've got a future speaker, Representative Jose Oliva, coming from Dade County after Speaker Designate Corcoran departs in a few years. There's a real sense of optimism with that new speaker, especially coming from Dade County, where some of their health problems are the worst in the entire nation. It's an area you think that if those folks were elected from Dade, they'd want to be a leader for the state on healthcare issues. But certainly the northeast coast of Florida, the Tampa region, and of course the central area of Florida, Orlando, Ocala, Kissimmee. This is an area that we're seeing tremendous amounts of Latino voters and people who really are going to have a big role in Florida's future. That's where they're coming to. And so, again, it's optimistic, but we need to be very thoughtful and targeted in our approach and apply what we know works to what the situation is. And the outcome, I think, is quite bright.